Hi guys, today we'll be talking about the autonomics of the GIT system. So, first of all, we'll be talking about the autonomic nervous system, and that is divided into our sympathetic and our parasympathetic systems. A good way to remember is our sympathetic is our fight or flight response, whilst our parasympathetic is our rest and digest system. And these act to modulate the organs that they are affected, that they have neurons connected to, and they affect them based on whether you're in a state of stress or in a state of relaxation. So in terms of sympathetic innervation, all sympathetic nerves originate from T1 to L3 as indicated by the red in our image to the right. There are a series of lateral ganglions next to the spinal cord called the sympathetic chain ganglia, or in this image, the sympathetic chain. These act as a structure that form an elevator system, which allows sympathetic nerves arriving at lower T levels or lower vertebral levels to rise or fall and exit to an appropriate level to innervate target organs. A key idea to remember about this, or the one concept that you will be tested in your exams on this, is whether where the sympathetic fibers exit and where they, how they synapse and how they enter back into and innervate the organs that they are trying to affect. So in terms of our sympathetic fibers, they will enter via white eye communicants and either synapse at the current or the paravertebral ganglia at the same level, or extend to paravertebral ganglia that are more superior or inferior and synapse there, leaving via our gray ramite communicant. This is depicted in the image to the right, or the furthest to the right. And basically what we see here is our presynaptic or our presynaptic fibers, or our presynaptic sympathetic fibers coming from our spinal cord, exiting via the ventral root, and then forming our mixed spinal nerve, where we have both our ventral and dorsal root nerves mixing, and then they enter this area known as the white ramus communicans. And from here, they either split, either going up or down to higher or lower levels of paravertebral ganglions, where they then synapse, forming our postsynaptic nerve fibers that then travel through our gray ramite communicants and then onto our organs to affect them. A good way to remember this is that nerves enter the column squeaky clean, so they go through the white ramite communicants, and after traveling through an elevator, they become dirty, and therefore they leave through the gray ramite communicants. Next on the topping block is the parasympathetic innervation. All the parasympathetics nerves either arise as cranial nerves or from the region of the S2, S4, known as the cranial sacral outflow. And this makes a lot of sense because the word para means on the side of, and the sympathetics, so therefore it's on the two sides of the sympathetic, which is where the parasympathetic originate. So looking at the innervation of the gastrointestinal tract, first of all, we're going to start off with some definitions. So splenic means relating to the abdominal and pelvic viscera, and therefore splenic nerve means autonomic nerves that innervate abdominal and pelvic viscera. The GIT is completely innervated by our autonomic system. And in terms of that, the sympathetic innervation of it comes off the spinal cord, as we noted before. However, they do not synapse on our paravertebral ganglia. And this, as many things in medicine, there's always an exception to the rule. Instead, these synapse at specific ganglions that are found around the abdomen or inside the abdomen. And they are technically, although when we learn it, we are focused on 3 major ones. However, there is also a 4th one. However, that's usually not tested, and often not noted. So first of all, we have the splenic nerve arising from T5 and T9, and this goes all the way and synapses on the celiac ganglia, where then postsynaptic fibers then act on the organ. Next, we have the lesser splenic nerve arising from T10 and T11, and this goes to the superior mesenteric ganglia. Next, we have the sacral splenic nerve arising from S2 and S3, and these go to the intermesenteric, inferior mesenteric, and the superior hypogastric plexuses. And synapses there then go on to affect their target organs. There is also the least splenic nerve arising from T12, and these go to the kidney synapsing at the orticorenal ganglia. And then these synapses there, and then their postsynaptic fibers, then innervate and target synapse on the target organ, causing the effects that they are wanted. This diagram to the right is a very nice summary of this, as if you follow each line, you can see where they go, where they synapse, and their target organs. As noted before, once the nerve synapse at the ganglia, the postganglionic fibers or the postsynaptic fibers then travel along the arteries in the periarterial plexuses. So in terms of that, that'll be like the celiac tract, the small mesenteric artery, and the inferior mesenteric arteries, as these vessels already directly go and feed the specific tissues. Why not have the nerves follow them with them? However, these nerves can also travel between the ganglia, and so innervation isn't super fixed based on this. In terms of parasympathetic innervation, the parasympathetic innervation of the gastrointestinal tract comes from the vagus nerve, or our cranial nerve 10, and the pelvic splenic nerves from S2 to S4. These do not meet at ganglia, rather synapsing at the organ and having very short postsynaptic fibers that innervate for the wanted effect. And the regions these innervate are distinct, with the parasympathetic supplied by the vagus nerve proximal to the splenic flexure, and the pelvic splenic nerves supplying the distal to the splenic flexure. This is probably one of the key points to remember, as if you were to get an MCQ question, it will be probably testing this concept about how far the vagus nerve innervates down the GIT tract and where the pelvic splenic nerve begins innervating. A good summary of this can be seen in this diagram, and it basically showcases the type of innervation and what type of innervation, either whether it is sympathetic or parasympathetic, the vertebral or the spinal cord levels or cords that it come from, and where they synapse, as well as their target. So as you can see, much of them are grouped based on which derivatives of the gut they are formed from, and therefore embryology matters, but only if you guys remember. Just to remember, sometimes you get confused that the sacral splenics sounding like they're coming from below L2 and L3, you might think, oh, sacral splenics, that must mean they are the parasympathetics. But remember, S for sacral, meaning also S for sympathetics, whilst P for pelvic, also meaning P for parasympathetics. And this is a very nice diagram that sums up, that has everything has been said, as also notes how the parasympathetics of the vagus nerve stop at the left colic flexure, which is then innervated further along by the pelvic splenic nerve.